How successful is MMA surgery? Have you ever wondered how effective maxillomandibular advancement surgery is for treating sleep apnea? This surgical option is gaining attention for its potential to significantly improve the lives of those suffering from obstructive sleep apnea. Let's break down what you need to know about the success of this procedure. Maxillomandibular advancement surgery aims to enlarge the upper airway by moving both the upper jaw and the lower jaw forward. This adjustment creates more space in the airway, which helps reduce the chances of airway collapse during sleep. When we talk about success rates for this surgery, they are generally quite promising. Studies show that the success rates for maxillomandibular advancement surgery can range from 64% to 90%. This variation often depends on the specific study and the characteristics of the patient population involved. For a surgery to be deemed successful, it typically means that the patient experiences a reduction in the apnea-hypopnea index to less than 20 events per hour, along with at least a 50% reduction in their apnea-hypopnea index after the procedure. A surgical cure is defined as having an apnea-hypopnea index of less than 5 events per hour, indicating a near-complete resolution of sleep apnea symptoms. In some reports, success rates hover around 85 to 86%, while cure rates can be approximately 37 to 43%. One study even noted a success rate of 64%, but keep in mind that these numbers can vary based on factors like the surgeon's experience and the individual patient's anatomy. Long-term follow-up studies indicate that the benefits of maxillomandibular advancement surgery tend to be stable over several years. Patients often maintain improved airway function and a reduction in sleep apnea symptoms. However, continuous monitoring is essential to catch any potential relapses or lifestyle changes that might affect outcomes. Interestingly, the experience of the surgeon does not seem to play a significant role in the overall effectiveness and safety of the surgery. This suggests that the success of the procedure relies more on how well the patient is selected and the specific surgical techniques used rather than just the surgeon's years of practice. Safety is another important aspect to consider. Maxillomandibular advancement surgery is generally regarded as safe, with a low rate of serious complications. Post-operative complications do not appear to correlate with the surgeon's experience, indicating that the procedure can be reliably performed across various clinical settings. For many patients, this surgery is considered when other treatments, such as continuous positive airway pressure therapy or less invasive surgeries, have not worked or are not well tolerated. It is particularly beneficial for individuals with anatomical issues that contribute to airway obstruction. Not only does this surgery improve sleep apnea symptoms, but it can also enhance facial structure and overall airway function. In summary, maxillomandibular advancement surgery is a highly effective surgical option for treating obstructive sleep apnea. With success rates often above 80% and cure rates around 40%, it offers lasting improvements in airway function and sleep quality. Regular follow-up after the surgery is essential to maintain these benefits and manage any changes in the patient's condition.